The NHS has perpetual, almost, scandals. We recently heard that Lucy Letby has been found guilty of murders, and that demonstrated some of the problems. As Alison Pearson put it, the NHS's warped human resources culture puts the well-being of staff above the safety of patients. But before that, we had the Nottingham maternity scandal, for which the independent midwife leading the investigation said families were simply not listened to and pushed away. This is a key point, not listening to families, pushing them away. Back in 2021, there was the young 13-year-old girl who died from sepsis after King's College London hospital staff failed to identify and properly treat the case and failed to listen to the parents who were increasingly concerned. There was also the Shrewsbury and Telford maternity scandal, in which many babies suffered brain damage or died, and mothers were left to take the blame, once again not listening to the patients and their immediate families. If we look back at history, there are other horrifying cases. The Harold Shipman case, the serial killer who murdered roughly 250 people. There's the contaminated blood scandal, the Staffordshire hospital scandal, thalidomide, Primados. The evidence is pretty conclusive. The NHS may do many things wonderfully well, but when it makes mistakes, it covers them up, and it is not infallible in its diagnoses. And yet, in spite of all this evidence, the NHS has taken an unnamed patient to court over her and her family's attempt to resist palliative care and try nucleoside therapy in Canada, for which she needs to raise £1.5 million. The patient, known only as ST, owing to draconian reporting restrictions, suffers from a rare genetic disorder known as mitochondrial depletion syndrome. Her disorder now requires regular dialysis treatment, feeding through a gastrostomy tube and a ventilator in order to breathe. The proposed move to palliative care by the NHS would see her die fairly quickly, which is why she and her family want a chance. They want to go and try the Canadian treatment as a last resort. But last month, a judge ruled that ST's fate is now the decision of the court, having been taken to court by the NHS, the family being taken to court to stop them having the treatment. And it was reported yesterday that the young lady's family is calling on the Health Secretary to give her a chance to save her life. But it should never have come to this. This young lady's suffering is immense. She is currently on course to be put on death row in a country that abolished the death penalty. The NHS is purely offering death. But who are these officials? Who are these bureaucrats in the NHS to tell this young lady that she has no right to pursue her last resort, to, in her own words, die trying to live? What's more, the court has imposed stringent reporting restrictions, maintaining the young lady's anonymity, which she does not want. It's been forced upon her. And this is turning anonymity on its head. The point of anonymity is to protect the patient, not to cover up for the hospital. The preservation of life is a foundational principle of our society, but it's being thwarted by the big state trampling on the rights of the individual.